it is important to understand that at the heart of all what we do is the human being.
And as the indicators begin to decline, you see the impact of a lack of focus, lack of policy attention, lack of funding in critical areas of health and education on the people.
NIMR Foundation is a child of necessity.
NIMR Foundation has been established as a public-private partnership kind of arrangements, which is meant to accelerate and further clarify the mission and mandate of NIMR.
Indirectly supporting government to fund health research, but this time around funding coming from the private organizations and individuals.
And then helping NIMR to channel those funding or those funds to those specific activities, that is building capacity and conducting research that will help the country to meet some of its health goals.
Funding for research is not compartmentalized. That means every quarter or every year you must return. So, and with NIMR Foundation, we'll be able to do that. So that if you attract funding that want to conduct a research that will last for more than 1 year, 2 years, 3 years, 5 years, through the NIMR Foundation will be able to allow such funding.
So our role is just to begin to interface with all levels of society, government, non-government, private, that research funding is important, research funding is good investment, research funding is good business, and research funding is a good life. It yields an improved quality of life in any society where it takes place.
Every day we face these pressures, and every day we understand that until we begin to look inwards, build our own research and industrial capacities in healthcare and education, we're going to continue moving backwards. We can no longer afford to depend on the outside world for our medical needs.
So you need to, one, develop capacity, human capacity for basic research, and then two, develop the infrastructural capacity where these researchers can work and have, some level of comfort in terms of accessing what they need at when due, and then able to generate the relevant information that is needed. Then go over to the next stage of applied research, and then of course come up with the implementation research.
There are key things we want to do, 3 of them. The first one is that, number one, we are providing fellowship awards. Fellowship awards meaning that we want to be able to identify early career investigators and bring them on board, build their capacity to be able to do research. And we are doing this by giving, number one, awards for PhDs and medical fellowships. We are doing grantsmanship training, and we are doing mentorship.
Research institutions globally have made huge sums of money that has helped to build the health sector of their individual countries. And Nigeria has such potentials in NIMR.
So we have to understand that nobody is going to come and set up priorities for us. However, they do recognize that there are potentials for making money from finding solutions to our problems. So one of the things we have to do as NIMR is to set our research agenda to be focused on the problems of Africa that are not receiving enough attention, and then try to attract the funding for that research.
And we as research institute require more funding, much more than many other areas, because research finds solutions to problems, especially health problems. And health research is perhaps one of the research that has contributed most to human development. And therefore, countries must necessarily fund research generally, but health research in particular.
It's also important to say that the NIMR Foundation will engage with media, and we have a robust health and science reporters in Nigeria that will be able to translate findings of NIMR into the public domain for them to have a clear understanding of what we are saying.
In the last few years, NIMR have become known. When NIMR's name is mentioned, it's mentioned it's like I said, with excellence. Now, NIMR is coming out with a foundation, NIMR Research Foundation, I'm sure if you listen to the board of trustees, you will know that we are coming out with a good product, a product that will promote innovation, a product that will build the capacity of future Nigerians to be able to be internationally competitive.
A country is as good as the research, as the way it's able to address its own health questions.
It pays to support research, either for social development or for business interests. Whichever way they want, they can always get.
Healthcare can be a vital contributor to national development, and that's what we are all about.
Whatever gives health should become a priority, because it is only a healthy herd of people that can build the Nigeria of our dreams, or Africa of our dreams.
All of us Nigerians must see a resurgent NIMR 44 years after it was created as a very, very huge opportunity, not only to deliver a better quality of life and life expectancy, but also to expand the economy, to open up sectors that have not yet opened up in our productive environment. This is an immense opportunity not to be missed.